My name is Esteban Lardone. I was born in Argentina. I've lived in Austin for about the last 20 years. I moved here to go to the University of Texas. I've been pretty active all my life, especially about the last 20 years. Rock climbing has been the major sport in my life, and I've played soccer most of my life, so I've always been very active and take that part of my life very seriously. I originally came to Dr. Dumitrescu, who I call Dr. D, because I had a really big injury on my hamstring, kind of climbing and training a little bit too much. And it was at a time when I was running my company and I was working really long hours, and maybe I didn't have like the full flexibility that my body needed to be able to train like that. And after many years of doing it, I pushed it a little bit too hard, and I had what's called a hamstring avulsion, which is when your hamstrings literally rip off your pelvis. It's debilitating. I spent 5 days in Brackenridge. I had a major surgery to get the hamstrings reattached to my pelvis, and the surgeon that was there is a really good surgeon here in Austin, Dr. Laverty, and he told me that the surgery went really well, but he did tell me that there was a really big chance that I was going to just have chronic pain for the rest of my life. I tried many different things, and I had heard about Dr. D, so I came to see what he could potentially do. And honestly, what I appreciated the most was that he told me that he could offer no guarantees, that he had treated similar injuries in other patients before, but we would have to just try it. So he set the expectations at a level that really worked for me. I did 2 rounds of stem cell injections, which came from my pelvis, and I also did at the same time 2 rounds of what's called PRP, platelet-rich plasma, and most of the time, close to 100% of the time, my hamstring feels at 100%. And when it doesn't, it's normally a sign that I've been sitting too long, or I got to go back to a little bit of the physical therapy. But I am super indebted to Dr. D, because it was on some days just a horrible pain in my pelvis, and it made sitting nearly impossible. So it was a major quality of life issue, and I'm back to rock climbing, and I'm back to climbing kind of at the level that I was before. And functional medicine is, for me, pretty much the only way that you should approach your health. When you see a traditional provider or your general practitioner here in the United States, it's not that they're bad, it's just that they have their hands tied a little bit. They only have 5 minutes to see you, therefore they cannot ask questions that you're going to be asked here. If you make an appointment here to really try to get your health to where you want it to be, the questions that you're going to get here are: how are you sleeping? How is the stress in your life? What are you eating? What are your daily habits? Those are the things that you can just learn and try to change to make long-term impacts on your health. And that's the approach that I learned here, and that is the approach that I've been using for the last 5 years that I've been a patient here with Dr. D and with Caleb Greer. I highly recommend Dr. Dumitrescu for anybody dealing with injuries, with pain, nagging injuries, pain that traditional orthopedics or maybe general providers could not solve or could not ameliorate. Dr. D's one of the most humble practitioners I've ever met, and his approach is trying to use your own body, use your own body's immune system and regenerative abilities to heal the issue that you have going on.